All right. So I have a few minutes past the hour, so we will go ahead and get started. Hello, everybody. Thank you for coming to today's webinar. We are going to be talking about successfully forming and sustaining collaborations, and really leveraging and using the Stepping Up initiative to help drive that work forward in your communities. All right. Sorry, letting people in still. Okay. I am Audra Goldsmith. I'm a project manager here at the Justice Center within the Behavioral Health Division, and I will kick it over to my co-presenter today, Cassie, if you'll introduce yourself as well.
Hello, my name is Cassie Neff. I'm the Criminal Justice Programs Manager for the Delaware County Sheriff's Office in Ohio.
All right. So that will complete our introductions for today. And again, we're going to talk about forming those collaborations, what it takes to build a successful collaboration, but also what it takes to sustain that collaboration over time. Again, implementing that Stepping Up initiative as a roadmap, really, and a framework for your collaborations to use and kind of use on repeat throughout the longevity of your councils. And then we're going to hear from Cassie, who is from Delaware County, as she mentioned, on the great work that they're doing there and the success that they have had in really sustaining their council for some time now. But we definitely want to leave time at the end for any sort of Q&A. All right. Many of you may know, and I think there are maybe a couple new faces, so I'll be brief. But I work for the Council of State Justice at the Council of State Government's Justice Center, and we are a national nonprofit, nonpartisan organization. We really strive in breaking that cycle of incarceration with a focus of people who experience mental health, SUD. We're starting to get into the realm of some traumatic brain injury, and other kind of facets that we know really impact folks recidivizing in this population. So Stepping Up is a national initiative. These are the three partners who run this initiative across all 50 states. And so, very quick on Stepping Up, but I want to really give time into forming collaborations, looking at the functionality of those collaborations, and what makes these collaborations successful. What do you need to tee up a successful coalition or collaboration in your community? But what things do you need to add into that recipe to make sure that you are having those things sustained over time? So when we talk about a collaborative council, what is that? What do we mean? We mean a convening of community stakeholders who are really going to meet consistently and regularly to talk about the issues and also successes, but challenges and barriers that they may face in their community. So who is that? Sheriffs, chiefs, commissioners, people in the health and housing gamut of your communities, peers, if you maybe have like a NAMI affiliate. So really it's any agency or stakeholder that has a hand in the game when it comes to criminal justice and behavioral health, SUD, and the like in that system. Right, this is a non-exhaustive list, but just to kind of put a visual on what I mentioned of who forms these collaborative councils. You can also add in people like community corrections folks to this list, people with lived experience to this list, again, your housing authority, and things like that. But these are really the stakeholders in your communities that you want to have around the table to talk about the issues that you're experiencing, but also the solutions that you want to bring to those issues and have this work not be siloed, but bring these things together in a community way that'll really have a positive impact long term. Right. So as we look kind of high level, what are the important aspects of having a collaborative council? Not only do we want to look at system-based approaches, we want to really pull in effective and meaningful ways to keep our public safe, but also reduce this specific population and how they are utilizing repeated services. So having that duplicate service. But we also want to make sure that this council is set up and really has the tools that they need to inform the people that make county level decisions and ensure that the dollars that you have available in your communities are being used effectively. So you're really that kind of voice of reason, if you will, on these are the things we see in our communities. These are the solutions we have come up with as a collective. And these are ways that we can ensure that our powers that be, the people that hold the purse strings, the people who make those policy decisions are informed. So how do these councils work, right? We're going to be guided by decision making through data. What do you see? What data do you have? And how are you leveraging that to make decisions within your communities and also to implement those best practices and things that are being shown to be successful in reducing recidivism, reducing the overutilization of multiple community systems, and so on. You are going to make recommendations, as I mentioned, to those decision makers, your community, your county commissioners, any sort of city administration, people that really are at that high level for decision making in your communities. And you're also going to be tasked to find those outside funding streams. So if these are things that you want to do in your communities, how are you going to fund them? What are your ideas? Maybe they're innovative, maybe they're a little bit out of the box, but what type of funding streams can you identify as this collaborative council to make these things come to light? All right. So when we think of a collaborative, I just keep saying collaborative council. So whatever that might be termed in your community, your stepping up council, a task force, a coalition, whatever it may be, right? I'm kind of just lumping all of that into one name here. So when you think of what makes a successful collaborative council, these are kind of essential components that will build a successful collaborative. You want to have leadership. You want to have that consensus buy-in. Why is it important for a person to be a part of this group? And what are their roles and responsibilities? How are these meetings organized and who's doing that organization? You want to develop that strategic plan. What's the purpose of this group meeting, especially for the long haul? Is it just to get together and kind of tackle a one solution? Probably not, maybe. And if that's, the reason for your coalition, that's really okay. But what we're talking about building here is something to sustain through time. So, what are you working for? What are you working towards? And really also engaging your community. So we have our council that's set up of however many members, but you also want to inform people that aren't involved in that council of what you're working on and what your goals are within your council, and how that could impact them in the community. Whether it's engaging them through surveys or focus groups or just putting information out there on your county's social media platforms, you want your people to know what you're working on and talking about, so that they can weigh in and provide any solid feedback, or concerns that they may have and raise issues that maybe you didn't think about. So, these specific key elements are going to supplement what I was just talking about on those essential things that build a collaborative. So we're talking about really looking at pursuing a system that is more just and equitable. We need to make sure that we are doing things productively and professionally. Although we might not all agree on a specific approach or how funds should be distributed, these conversations are meant to be productive. Even if we have that, what can be termed as positive disruption, it's okay to have those, but they need to be had in order to have any sort of long game systems change, right? And that we need to make sure that we are effectively responding to crisis for the population that we're trying to serve. We want to make sure that we are including that perspective of those with lived experience, whether that be a person directly who has experienced mental health, SUD in the criminal justice system, or a family member or caregiver. We want to make sure that we're bringing that sort of a voice into our council. We want to have that strategic plan that I talked about, and that can be something short term. What can we accomplish in the next 3 months? What can we accomplish in the next month? But what can we accomplish and what are our goals in the next 5 years, 2 years, whatever it might be. So those are pieces that are very important when you're also talking about what's the purpose of this council and who are people's roles? What are the roles that a judge has? What is the role that a sheriff has? And so on and so forth. So you can implant those types of elements as you build out a strategic plan that really informs people of why they are engaging in this group and make it important to them. All right. Okay. So as you're forming your councils, as you are talking about who should be at the table, as you are thinking about what are our guiding principles, how are we driving this work? How are we building that foundation of professionalism and camaraderie, and having this vision of what types of services and goals we want to implement in our communities? This is really where that stepping up framework can fit in. I have a lot of counties that have come to me before and said, Audra, we meet, we kind of are siloed, or we meet basically via email and kind of get things accomplished, but not really. So what do we do? How do we really drive this work? And my answer back to them is A, meet consistently, get your planning team and your folks, you have to get that buy-in. And B, you have to get a roadmap. What type of a roadmap are you using to drive this work and to be able to sit down and be like, check, 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 we did, we didn't do that. We need to go back and focus on it, right? And that's where stepping up comes in. So this is a framework with the intention of not to be walked through once, but to be walked through and then circled back around, right? So to be engaged at all times. So just quickly on the initiative, stepping up, we are going to be celebrating our 10-year anniversary coming up. So we're very excited about that. We are in over 580 counties across the country. There are 5 state-led initiatives across the country, with only 2 individual TA centers. So obviously this one in Kansas, and then I have a counterpart also in Pennsylvania. I'm just going to check the chat real quick to make sure there aren't any lingering questions here. Okay, thank you everybody who introduced yourself in the chat. Just to touch quickly on this framework, and I'm really going to focus in on this kind of Q1, this leadership commitment. So if you're not as familiar with stepping up, we have these key questions that we challenge or give to these collaborative councils and say, answer these things amongst yourselves in your planning team and in your councils, and this will help you drive the work. So that one is that gaining that leadership commitment. And that's where we're talking about this forming your collaborative councils and sustaining that buy-in. That Q2 is timely screenings. So stepping up is very data driven. And by doing that, we recommend having a validated screening tool at booking in the jail to screen every single person that's coming in. And that will lead you to Q3 is having that baseline of data. It's important to know the magnitude of the issue in your specific county and your specific jail before you can apply appropriate and financially sound processes, practices, policy changes that'll have a good impact. So we want to make sure that we're directing our energy and our resources towards things that we know are going to be successful. And then taking time to really look at that process inventory. So what's going on in our communities? What evidence-based practices, policies, programs do we already use? But where are these gaps? And of our data that we collect, what types of policies, programs, services do we want to look at implementing? And so each of these key questions really feed into each other. And so that's the point of the framework is to give you that roadmap. And to walk through with your councils and then go back and re-walk through. Especially when it comes to data, you want to ensure you're having good quality. When it comes to that process and inventory of services, those things change all the time. And that really drives your strategic planning in the long run. When you're looking at funding opportunities are always out there and changing, especially best practices on policies within different entities. So these things can always be revisited, and you always want to track your progress. How are things going? If you implemented a new program, what does the data say about the program? What do the consumers of this program say? Or the people providing, the direct care providers of this program? How's it going? If it's not going all that well, maybe it's time to go back to the drawing board and get a new strategic plan on how to enhance it or maybe implement a different service that might have a more positive outcome. All right. So I mentioned stepping up is very data driven. These are our 4 key measures that we recommend counties collect from that jail data from that validated screening tool. Amongst others, but if counties are working to establish that baseline, these are really the 4 key measures that we want counties to be able to collect and work to build that data capacity.
Didn't mean to scare you. No, you're good.
All right. So general recipe for stepping up. You have to have kind of follows those 6 key questions. You have to have county buy-in. We usually recommend that you go to your county commissioners and say, this is our interest, this is what we want to do, and this is why. And that you do that as a collective, right? So if they see stepping up or your collaborative council be the head of your mental health, the head of your housing, the head of your community corrections, your sheriff, people are more apt to say, oh, this is an interest of folks, not just a siloed type of program or initiative, right? And I'm not going to walk through all of these, but these are kind of the steps you can take as you start to utilize the stepping up framework in your communities. You can research different funding options as you get that up and running. And then just really start to drive that collaborative work going on in your community. All right. So as I mentioned, I do really want to focus on that. Is your leadership committed? Excuse me, just a second. All right. So why does this matter, right? Well, if we don't have good buy-in from the people who are forming our collaborative council, if they're unsure of their role, if they don't really understand how their specific agency or position impacts this work, it's not going to be that meaningful, and they're probably not going to always be engaged or engage at all, especially when we're talking about sustaining this type of a council. And you really want to work on building that consensus over a vision, right? Let's say people sit down, everybody's super engaged, but somebody has a vision of uplifting a crisis stabilization unit, and somebody else has a vision of implementing a community response program, right? You don't want to have conflicting visions. You want to be able to come together and really prioritize what types of services, programs, policies, and prioritize those things to make the best impact to really help the systems in your communities. So you want to start out by identifying that core team. As we mentioned, I had that little graph of who all that involves. And I also want to mention that, outside of the sheriff, the chief of police, all of these head policymakers and officials in your communities, you can also pull in and bring in people who champion this work, and they might not have a position at any of these agencies that are at that intersection of criminal justice and behavioral health. But maybe they understand funding. Maybe they understand grant writing. Maybe they understand data. Maybe they understand just any sort of aspect that and champion that in your community. So they're reputable for doing this good work and building collaboratives and working on strategic plans in your community. So you also can identify somebody like that. You will work within this collaborative, as I mentioned, on engagement. So let's say you have maybe a judge in your community who is a little bit resistant or really just doesn't understand why you want to bring this initiative into your community. You can strategize that within your collaborative council on how are we engaging in maybe a resistant stakeholder, right? And how are those things coming to light? And maybe there's some conversations and different outreach that can be chatted about within your councils to maybe make that engagement and build that bridge a little bit more successfully. Okay. So what I wanted to do in this slide is really kind of break down some questions I've been getting with the TA Center are, we have a planning team or maybe like a contact who really drives the stepping up work in our communities. And we talk about the validated screening tool, like check. We're establishing a baseline kind of check. But what do we do now? Or, they might not have done some of those things, but I just get the questions of, we have a stepping up council, we passed a resolution, now what? So I wanted to break it down a little bit. So if you are that coordinator or you're that go-to champion of stepping up within your communities, these are some steps that you can take as you walk through the framework and make sure that you are discussing and action steps are being planned within your stepping up councils, your collaborative councils. So if we focus on kind of this Q1, is your leadership committed? We want to make sure that you have passed the stepping up resolution, right? That you have assembled a planning team. And that goes back to that outreach. Is it one-on-one outreach? Is it, hey, let's schedule an in-person coffee because we haven't talked in 3 months? So it's really talking about and strategizing on implementing that planning team. And then you also want to make sure that you're developing that mission and vision once you have a planning team in place. For Q2, and we talk about that validated screening tool, is there one implemented? Maybe there's some conversations that need to be had with your sheriff or whoever your jail administration is on why a validated screening tool is more accurate at identifying the mental health population or people who have mental health concern than just a regular questionnaire. So you want to develop some screening protocols. Another question I get too is how do we kind of train somebody new? Maybe there was turnover in whoever runs your stepping up, and or there's turnover at the jail, and they're going, I don't really know how to do this validated screening and who pulls the data and X, Y, and Z. So it's important to take time within your council to talk about setting up and actually putting pen to paper on some process and protocols for your data collection and screening processes. And then how are we collecting the data in our communities? How are we leveraging that data? And what is the data really telling us? Again, policies and processes, pen to paper on who's producing these reports, who's pulling the reports monthly, who needs to see these reports. And maybe there's some data matrix within those reports that aren't being collected that an entity within your stepping up council wants to know about. So it's good to talk about what data points are important outside of just those 4 key measures for your council. And again, that'll walk you to going to that process inventory, making a list or coming up with a detailed service gaps and what is and isn't available in your communities, and really having those positively disruptive conversations of prioritizing that, right? We might have competing values, we might have competing goals. So how do we come together as a community and as a stepping up council to prioritize and pick which is priority number 1 over 2 over 3 and what the time frame of those things are to potentially get those completed. And then it's also very good for this collaborative leader or whoever's going to champion this work to think about how often are you reporting progress and who is getting those reports as well, so that you can see maybe how your bookings are going for the last 5 years or the last 2 years. What do your recidivism numbers look like? And although we can't directly correlate, but maybe you implemented a mobile crisis program in your community, and over the next 3 years, you saw recidivism rates go down. right? So how are you looking at your data to see the impact and the progress that maybe some of these services could have had an impact on? All right, and I'll just briefly go over the Stepping Up TA Center for folks who might not be as familiar. I've been running the Kansas Stepping Up TA Center for going on 4 years, although I think it has actually been closer to 5 that it was actually launched in Kansas. And really, the benefit of the TA Center is having a direct contact person. So, as counties in Kansas are looking at implementing Stepping Up, or they're having questions on which is the best evidence-based practice for X, Y, or Z, or how do we build those bridges between these entities, or how do we get data? Having that go-to person and that boots on the ground to really make those connections and provide that technical assistance is one of the highest benefits of the TA Center. As I mentioned, Pennsylvania is the only other state. And then people always ask, what's the spread of stepping up across Kansas? When I started, there were only 8 stepping up counties in Kansas, and we only had 3 or 4 innovator counties. So we have grown. I will also note that I do have a lot of counties that do interact and just haven't really formally passed a stepping up resolution. And some counties who are at that innovator level who just haven't applied to become an innovator. So these numbers, they could change at any minute, I guess, is what I'll say. But this is really the impact that Stepping Up and the TA Center has had across the state. All right. And I think I even did good on time. Woohoo, Cassie. I will pass it over to my co-presenter, Cassie Neff, to talk about their collaborative in Delaware County.
Thank you. Thank you. Okay. Yes, so as I mentioned, hello, thank you everybody for being here. My name is Cassie Neff. I am the Criminal Justice Programs Manager for the Delaware County Sheriff's Office in Ohio. I have been with the Sheriff's Office for 12 years, and my responsibility as a Criminal Justice Programs Manager is to design, develop, implement, and provide the oversight for the inmate programming in our county jail, and I am our county's Stepping Up coordinator. Can I have been? Okay, you got it. A little bit about Delaware County. So our county is centrally located. We are just shy over 450 land area and square miles. And our population, we are considered a mid-sized county. We're just a little bit over 250,000. We are ranked the healthiest county in Ohio by the Robert Wood Johnson Foundation and ranked number 10 in the country by the US News and World Report. On average, our median family income is $123,000. So yes, Delaware County it's a wonderful place to live, and we have so many great resources. However, if you are a vulnerable population or you live in a pocket of poverty in Delaware County, I think it hits really hard because of the cost of living in Delaware County. So I think it's important to talk about that. Our county jail, we are recently accredited by the American Correctional Association, and we also are certified in the Prison Rape Elimination Act. We're compliant with PREA by the Department of Justice. So our jail's capacity, we are a 286 bed facility. However, our average inmate daily population is 138. So over the past 12 years, that has been decreasing. We are not like other counties in Ohio and even nationally, where you see the incarceration rates rising. And perhaps commissioners are making hard decisions and discussing funding to build a new facility. That is not an issue in Delaware County. When I first started 12 years ago, our average inmate population was 220. And now we're sitting at 138. A lot of that attributes to the work of our Stepping Up committee. So what does our population look like? And we utilize the behavioral health screens that Audra talked about. That tells us who is in our jail and how can we best connect them to services. So 12% is screening for a mental health issue. 66% screens as having a substance use issue. We have a 55% recidivism rate for the general population, and that's compared to a 25.5% recidivism rate for individuals that participate in our LINK program, which I will talk a little bit more about in a few slides. Next. Okay. We joined Stepping Up 10 years ago in the winter of 2015, and our Stepping Up committee has been championed by the same three key stakeholders. I think that is important to note. So our sheriff is well-versed and knowledgeable in what Stepping Up means, talks about it in all the different corners and coalitions that he's in, same as our commissioner. Our commissioner also sits on a national level. She sits on the National Association of County Commissioners, our Criminal Justice Public Safety Committee. And then our executive director of our Mental Health and Recovery Services Board. Those are those three champions that really influence and sustain our Stepping Up committee. I am our designated coordinator. And next slide. Okay, so we passed our proclamation in 2016, and the first step that we took, or how we launched Stepping Up in our county, is we hosted a 2-day workshop called Sequential Intercept Mapping, or SMI. This is where we did a complete analysis of our criminal justice system and focused on strategic planning and collaboration to develop a comprehensive, localized action plan. This was attended by over 40 individuals from support services, behavioral health services, criminal justice services, and they didn't know it then, but those individuals became members of our Stepping Up committee. So from our sequential intercept mapping, we identified 5 priorities of change and then created subcommittees to advance those goals. The 5 priorities of change included housing, transportation, bed capacity, specifically psychiatric bed capacity, defining mental illness and tracking data across all of these systems, and jail data and information sharing. Next slide. So our organizational structure, how are we organized? We are guided by an executive planning team of local agency and organizational leaders. Now, we'll say that small core planning team, some of the members change, but those 3 constants stay the same, with the sheriff, the commissioner, and the executive director of our local mental health and recovery services board. I drive the work. I am the dedicated coordinator. So I have the pleasure of creating the agendas, gathering the data, reporting the data, herding the cats, if you will. And then our work gets done through the 5 priority work groups. Our large committee convenes quarterly. And I think it's important to note that in Ohio, we have a vital partner called our state Stepping Up coalition. And it sounds like, Audra, you may be that for Kansas. So we have this horizontal support, right, at our county level, but then we have the vertical support from our state Stepping Up. Our state Stepping Up is led by a rock star. She is a retired Supreme Court justice, and her name is Evelyn Stratton. And if you've heard of Eve, then you know what I'm talking about. I was at a conference once, and somebody said that they were not from Ohio. And they were like, man, Ohio, you got it going on. You have LeBron James and Eve Stratton. And he was right. We do. So Eve gets the state stepping up work done through our Attorney General's Mental Health and Criminal Justice Task Force. So it's this wonderful partnership, and I'll give you, there are many examples of the benefit of that, but one that comes to mind was we had a problem in the jail. Our jail physician, she couldn't, in order for her to provide mental health medications for inmates being released, she had to be on site. However, we only contract for 10 hours weekly of physician hours. So we went to our state stepping up committee, told them our problem, and they attacked it. Part of the membership of the state stepping up committee was a person who sat on the Ohio Pharmacy Board. So those folks problem solved, and they worked together to create permissive language that allowed 100% of jails to release individuals with mental health medications, essentially giving the jail physician the authority to let the nurses dispense the medications for inmates being released. Also, our state stepping up committee, they release a monthly newsletter, and that's wonderful. It's just where they do the work of gathering all of the grants, webinars, trainings, workshops, and they email that to each of the county's coordinators, myself, and then I disperse that to our listserv. And we have over 100 people on our email listserv. Now, not all 100 people come to the quarterly meetings. On average, there's about 20 people that come to the quarterly meetings. But I'm confident most of the individuals read that, and they do share with me that it's beneficial. So one example of a project that came out of Stepping Up, or how does Stepping Up look like in Delaware County, is, okay, so we signed up 2015, did our strategic analysis in 2016, then we identified a grant to pursue in 2017, and we were awarded that grant. And what we wanted to do was we wanted to expand the jail programs and create reentry services in Delaware County. We received a grant through the Ohio Department of Mental Health and Addiction Services and implemented our Jail Link program. That stands for Lives in Need of Connection. And essentially the Link program is a team of multidisciplinary professionals that wrap around folks in jail. Everybody gets a reentry plan, and depending on how long you're in jail, then you may have time to participate in more clinical interventions, whether that's groups or individual counseling. But it's 5 dedicated staff. There's a picture of only 4 individuals because I am the one taking the picture. But you have myself and our jail programs coordinator. We work for the sheriff's office and we are housed in the jail. So our primary role is to be the liaison between the inmates and the community providers, but also community providers and the jail staff. So we are screening and identifying all of the inmates, creating the list, the class rosters, managing all of the scheduling, the jail operations, the logistics. And it works really well because we understand the jail. We know the meal times. We know when court goes out. We know the schedule of the doctor, the haircuts, when the mobile dentist comes in. So while we're building all of our programs and those schedules, we're mindful of that, so it operates very smoothly. I have other partners in other counties that they do it differently, where it's a contracted agency that essentially just kind of shows up to the jail and says, hey, these are the list of inmates that we want to see. And they get it done, but the way that we're doing it is it's more efficient and quicker because we understand the bigger picture. We have a in-house full-time mental health clinician and another counselor and a case manager. So Maryhaven and Southeast, those are the 2 community behavioral health providers in Delaware County. What does a typical release look like for a Link participant? Most of the time, it is a volunteer program. So if that person allows the case manager to walk alongside them during their release, then that's what happens. So our case manager's name, her name is Aspen. Most of the time she will just meet them in the jail lobby and then provide that transportation to their probation officer, or take them directly to residential treatment, or take them to wherever it is that they're going. But that reentry plan is developed prior to release, and then she's there to help execute it and provide ongoing support. Next slide. The LINK program is just one program in our jail. So on average, we operate 50 hours of group programming per week, and that is provided by over 200 community partners and volunteers. So as my role, I'm the program manager. So I'm designing and developing and creating relationships with other agencies to bring them in. I am looking for a case management component. All of the programs that we have in the jail not only provide some type of service, but also ongoing support through case management. So no matter what program that you participate in the jail, you have that two-pronged approach. And taking a peek at our data, because this is part of our Stepping Up initiative. All of the programs and positions and projects that come out of Stepping Up, we want to make sure that we are collecting data to understand whether or not it works, but then also present that to the decision makers in hopes that they would want to sustain it. So looking at our recidivism for the Delaware County Jail, we have been operating the LINK program since 2018, and I have all of that data since 2018, but I'm just going to give you a snapshot of the past couple of years. But each year, it has yielded to cut the recidivism in half. I'm working on the full calendar year of 2024 right now, so I only have January and June to present to you today. But last year, our January through June recidivism rate for LINK participants was 5% compared to 58%. Looking at 2023, 25% compared to 55%. The year prior to that, 9% compared to 55%. And the year prior to that, 23% to 54%. So yes, it does move the needle. It does work. Next slide. Some other spotlights that I wanted to talk about that came from our Stepping Up initiative is we have embedded service coordinators in first responder agencies, and this has shown to be very successful. There's a service coordinator in our city fire department and our city police department, and those individuals check the calls for services the day before. Audra, you referred to the co-responder model. We looked at that and we determined that that wasn't the route that we were going to go. We didn't want to send a counselor alongside a deputy at the time of the crisis. We're providing service coordination 24 hours after the call for service, if you will. So that individual looks through all those call for services through the 911 CAD center, and we can pull the aggregate data to say CIT means a mental health call. And then there's another disposition code for an overdose call. And then they are providing in-person outreach services. Another really special project that came from Stepping Up was we opened our very first recovery house in Delaware County. And I talked about Delaware County being very resource rich, but what we lacked is there was no recovery housing in Delaware County. So when I was completing applications for individuals who were interested in residential treatment, it was outside of the county. So there was a gap. How our recovery housing was born was through members of our Stepping Up committee. So not only are there members from your behavioral and your criminal justice system, but we have a lot of members from our faith-based system. So it was a partnership from a local congregation, a nonprofit who was interested in starting in Delaware County, and the sheriff's office. The church had a house that wasn't being used and rented for a very reasonable price to the nonprofit. And then the sheriff's office, we developed protocols to provide referrals. So the model for this recovery housing was for individuals coming out of jail. Of course, the house quickly filled up and and the tenants' successes were measured, and they were doing great. So great that the local mental health and recovery services board actually started to contract with this nonprofit, and 6 months after opened a recovery house for men. The first recovery house was women, and the second one was men. We established our jail medicated assisted treatment program for individuals in long-term opiate use, like in long-term recovery from opiate use disorder. The Delaware County Housing Alliance was another just special example of just how beneficial stepping up is. So remember when I talked about our 5 priorities for change, housing was one of those. One of the projects from the stepping, or from this, I'm getting all mixed up. The subcommittee of housing opened the recovery house. That was doing wonderful. So the next project that they were tackling is we still had this issue of housing, of the lack of safe and affordable, attainable housing in Delaware. So Stepping Up joined forces with United Way, a nonprofit, and our public health district. We hosted a series of community conversations, and this is really where we used the influence of Stepping Up. So to get people to these community conversations, the invitations were directly from Sheriff Martin, Commissioner Lewis, Executive Director Brandt of the Stepping Up of our Stepping Up committee. Please come to these community conversations. So the summer of community conversations and strategizing, thus was born the Delaware County Housing Alliance, which is its own 501(c) nonprofit. Some examples from the Delaware County Housing Alliance or projects was we raised $100,000 and hired a consultant to do a housing study of Delaware County. And from that study, that data drives those projects. In 2023, they opened a transitional house for at-risk youth. When I say youth, these are 18 to 26-year-olds coming out of jail or aging out of the foster care system. We established 24/7 mental health crisis coverage from the jail. This was a direct result from the data that we tracked in the jail. So our full-time mental health clinician is also a health officer. So she can pink slip, which means an involuntary commitment to hospitalization during first shift, Monday through Friday, 8 to 5. That's not when the crises were happening. So we created a system internally in the jail to track these crises. And we reported that aggregate data to our local mental health and recovery services board. So from that data tracking and sharing project, the board created a 24/7 coverage for the jail. So they started that coverage for Delaware County and expanded that coverage to Morrow County Jail. Equine therapy for justice involved. This was an awesome partnership with a local nonprofit. A problem that we identified is that folks that we were working with were getting just kind of like exhausted with all of the AA meetings and the counseling appointments and the group counseling, and they just wanted to have connections, sober connections, healthy connections, and do something fun that was outside of the traditional treatment plan. So we have a nonprofit that provides equine therapy, and we pursued some grant money, and we were awarded it, and created peer support groups for justice involved individuals. So the referrals come straight from the jail, and those folks do equine therapy at the farm. We established a Delaware County Guardianship Services Board. This is huge. So now the jail can submit referrals directly to a guardianship services board. Our jail physician completes that expert letter of evaluation, and we can start to plan those intervention and stabilize that person prior to release. There are many success stories that I could tell you about, but I am running low on time. But this has really been a game changer. Prior to having a guardianship services board, there were attorneys in the county that volunteered to be wards, but they have a capacity. I don't remember what that capacity is, but say it's 15 for the sake of time in this presentation, and they were all at capacity. So there were 2 years that there were no wards available. There were no attorneys that had space to take on new clients. So the county came together, and through a partnership with the Delaware County, the Mental Health Recovery Services Board, and the DD Board, hence the Guardianship Services Board was created, and that is a county entity. Again, the service coordinator model embedded in first responder agencies or government agencies. So last year, the public defender's office hired a social worker. And I will say the sheriff's office, we are pursuing hiring a service coordinator as well. So this has just been a very successful model in Delaware County in providing intervention and connecting people to services. So that concludes my presentation. Thank you for taking the time to listen. And then we have time for questions and answers.
Yes, thank you so much, Cassie. I love how that just really paints a picture of the success that your collaborative has had over the years of talking about prioritizing, coming to agreements, and really bringing to light the services and programs that they found would have a positive impact in your community. I really love how you touched on really the strategic outreach as well. I think that's an important thing that I wanted to have folks kind of take back with them is, you mentioned the actual sheriff or one of your upper community leaders giving those invitations to people that need to be at the table and be in these conversations. So I appreciate that you kind of highlighted and that you guys experience success with that, because that's really what we promote and what we really encourage counties to do as they're developing their collaborations. So does anybody please come off mute? You can throw it in the chat. I'm going to skip a slide and then I will actually take them down so we can have some time to talk. I will send these slides out, so don't feel like you have to grab these links just yet, so you can have them. And let me stop sharing. I just like to see people's faces for Q&A. Okay. I saw a question in the chat. So from Tim, Cassie, the question is for you. He's asking, did the LINK program have qualifiers to be a part of the program? And do you think that it could be scaled to a 1,400 bed facility?
Yes. Yes, there are qualifiers, and yes, I do think it's scalable. So because 2 staff persons are funded through a grant through our local mental health recovery services board, we do have to prioritize serving individuals that are returning to Delaware and Morrow County, but we also can serve homeless individuals. So that limits a pool of people that we can serve in the jail, because there are many people that are in the jail from other counties, right? Because if you commit a crime in Delaware County, then you come to our jail. It doesn't matter where you live. That is why we have all of the other supplemental programs. So yes, I do think it can be scalable. My biggest recommendation would be to consider having an internal person to coordinate that. If we were to rely on our shift sergeants to do everything, it wouldn't work. They are doing so much already. They don't have the time and capacity to organize this in a big part. So I have a program coordinator who does the boots on the ground, organizing, screening the inmates, creating the class, rosters and scheduling, but a big part of what I do is out in the community. So I'm out there getting to know our community partners, developing those relationships, writing the grants, writing the MOUs. So I'm bringing those programs into the jail and she is running. So I think you need somebody like that. I don't think it would work very well if that duty had to be a person who is running the jail security wise.
Any other questions from the group? Okay. Well, I do. Cassie, would you speak a little bit more on like what do you feel is kind of the key ingredient or two of really having this collaborative be sustained since you passed a stepping up resolution in like 2015? So what do you feel like is those key ingredients that has made that successful for Delaware County?
I think relentlessly talking about it, making sure that everybody knows what stepping up is, that's a big part of what I do. And it can become tiring sometimes, but I'm just I am passionate about stepping up. So sometimes I get exhausted, but it works out. So I think what has contributed to the sustainment is when there is a new elected person, I schedule a time to meet with that person to talk about stepping up, to tell them everything that we've done, to bring them up to speed on the history and invite them to become a member. Not only elected officials or key administrators, but all of the support and behavioral agencies. Talking about that. I prepare presentations for our sheriff and our commissioner. So when they are at their conferences or in doing their thing on different levels that may not directly have to do with stepping up, but they're prepared to speak about it and they can kind of sneak it in. Like, for example, Commissioner Lewis, every year the county commissioners have a presentation to the community and she speaks about stepping up. So for 10 years, the community at large has been hearing this. We do a lot of media coverage. So we just make sure that people know what stepping up means and are at least familiar with it.
Awesome. Thank you. Okay, well, I know we're approaching the hour. Again, the slide deck, I will send it out to everybody on the screen, although if some of you don't mind, well, I can get it from the registration. So I'll have everybody's emails, and I'll send out the slide deck. I will have the event recording put up on the Kansas Stepping Up website. But it usually does take just a little bit of time to get that prepped and uploaded and ready to go. So once that is available, I will probably send it around to the distribution list at large so you can see that coming. Let me throw the TA. That is the web page. If you have any questions or if you feel like there might be need to further chat with Cassie, I'm going to speak for you, but I'm sure she would be willing to do that. So feel free to reach out to me and let me know. Again, thank you all for participating and we'll be in touch. Have a great rest of your day.